Okay, Fat on the Move from Dr. Simeons, Pounds and Inches. Remembering this, it occurred to me that the change in shape could only be explained by a movement of fat away from abnormal deposits on the hips, and if that were so, there was just a chance that while such fat was in transition, it might be available to the body as fuel. This was easy to find out, as in that case, fat on the move would be able to replace food. It should then be possible to keep a fat boy on a severely restricted diet without a feeling of hunger, in spite of rapid loss of weight. When I tried this in typical cases of Froelich syndrome, I found that as long as such patients were given small daily doses of HCG, they could comfortably go about their usual occupations on a diet of only 500 calories daily and lose an average of about 1 pound per day. It was also perfectly evident that only abnormal fat was being consumed, as there were no signs of any depletion of normal fat. Their skin remained fresh and turgid, and gradually their figures became entirely normal. The daily administration of HCG appeared to have no side effects other than beneficial ones. From this point, he doesn't use commas, so I've got to, try to emphasize correctly. From this point, it was a small step to try the same method in all other forms of obesity. It took a few hundred cases to establish beyond reasonable doubt that the mechanism operates in exactly the same way and seemingly without exception in every case of obesity. I found that, though most patients were treated in the outpatients department, gross dietary errors rarely occurred. On the contrary, most patients complained that the 2 meals of 250 calories each were more than they could manage, as they continually had a feeling of just having had a large meal. Pregnancy and obesity. Once this trail was opened, further observations seemed to fall into line. It is well known that during pregnancy, an obese woman can very easily lose weight. She can drastically reduce her diet without feeling hunger or discomfort and lose weight without any way harming the child in her womb. It is also surprising to what extent a woman can suffer from pregnancy vomiting without coming to any real harm. Pregnancy is an obese woman's one great chance to reduce her excess weight. That she so rarely makes use of this opportunity is due to the erroneous notion, usually fostered by her elder relations, that she now has 2 mouths to feed and must keep up her strength for the coming event. All modern obstetricians know that this is nonsense and that the more superfluous fat is lost, the less difficult will be the confinement, though some still hesitate to prescribe a diet sufficiently low in calories to bring about a drastic reduction. A woman may gain weight during pregnancy, but she never becomes obese in the strict sense of the word. Under the influence of the HCG, which circulates in enormous quantities in her body during pregnancy, her diencephalic banking capacity seems to be unlimited, and abnormal fixed deposits are never formed. At confinement, she is suddenly deprived of HCG, and her diencephalic fat center reverts to its normal capacity. It is only then that the abnormally accumulated fat is locked away again in a fixed deposit. From that moment on, she is again suffering from obesity and is subject to all its consequences. Pregnancy seems to be the only normal human condition in which the diencephalic fat banking capacity is unlimited. It is only during pregnancy that fixed fat deposits can be transferred back into the normal current account and freely drawn upon to make up for any nutritional deficit. During pregnancy, every ounce of reserve fat is placed at the disposal of the growing fetus. Were this not so, an obese woman whose normal reserves are already depleted would have the greatest difficulties in bringing her pregnancy to full term. There is considerable evidence to suggest that it is the HCG produced in large quantities in the placenta, which brings about this diencephalic change. Though we may be able to increase the diencephalic fat banking capacity by injecting HCG, this does not, in itself, affect the weight, just as transferring monetary funds from a fixed deposit into a current account does not make a man any poorer. To become poor, it is also necessary that he freely spends the money, which thus becomes available. In pregnancy, the needs of the growing embryo take care of this to some extent. But in the treatment of obesity, there is no embryo, and so a very severe dietary restriction must take its place for the duration of treatment. Doesn't that make sense? Makes sense to me. Only when the fat which is in transit under the effect of HCG is actually consumed can more fat be withdrawn from the fixed deposits. In pregnancy, it would be most undesirable if the fetus were offered ample food only when there is a high influx from the intestinal tract. Ideal nutritional conditions for the fetus can only be achieved when the mother's blood is continually saturated with food, regardless of whether she eats or not, as otherwise a period of starvation might hamper the steady growth of the embryo. It seems that HCG brings about this continual saturation of the blood, which is the reason why obese patients under treatment with HCG never feel hungry in spite of their drastically reduced food intake. The nature of HCG. HCG is never found in the human body except during pregnancy and in those rare cases in which a residue of placental tissue continues to grow in the womb in what is known as a chorionic epithelioma. It is never found in the male. The human type of chorionic gonadotrophin is found only during the pregnancy of women and the great apes. Wow. It is produced in enormous quantities, so that during certain phases of her pregnancy, a woman may excrete as much as 1 million IUs per day in her urine, enough to render 1 million infantile rats precociously mature. Horny. Other mammals make use of a different hormone, which can be extracted from their blood serum but not from their urine. Their placenta differs in this and other respects from that of man and the great apes. This animal chorionic gonadotrophin is much less rapidly broken down in the human body than HCG, and it is also less suitable for the treatment of obesity. As often happens in medicine, much confusion has been caused by giving HCG its name before its true mode of action was understood. It has been explained that gonadotrophin literally means a sex gland-directed substance or hormone, and this is quite misleading. It dates from the early days when it was first found that HCG is able to render infantile sex glands mature, whereby it was entirely overlooked that it has no stimulating effect whatsoever on normally developed and normally functioning sex glands. No amount of HCG is ever able to increase a normal sex function. It can only improve an abnormal one, and in the young, hasten the onset of puberty. However, this is no direct effect. HCG acts exclusively at a diencephalic level and there brings about a considerable increase in the functional capacity of all those centers which are working at maximum capacity. Okay, the next subject will be the real gonadotrophins. Whatever. The G and HCG. Okay, stay tuned. Bye.